Good morning all of you. Today I am going to discuss about the urinary tract anti-infective agents. Before going into the topic, we have to know what is urinary tract infections. These are all the infections which mainly affects the part of the urinary tract. If it affects the lower part of the urinary tract, then it is known as cystitis, otherwise known as bladder infections. If it affects the upper urinary tract, then it is known as pyelonephritis or kidney infections. These the symptoms of the lower urinary tract infections are there will be frequent urination and pain during the urination. In case of upper urinary tract infections, there may be fever, and in addition to that there will be frequent urination and pain in the urination. Okay, this is about the urinary tract infections. The drug that is useful for the treatment of urinary tract infections are known as urinary tract anti-infective agents. Historical background. The second one is historical background. In 1962, George Leeser synthesized chloroquine. While synthesizing the chloroquine, he discovered the nalidixic acid. It is the first quinolone. This is the structure of nalidixic acid. The basic nucleus that is present in the nalidixic acid is naphthyridine. Usually a benzene which contains only one nitrogen atom, then it is known as pyridine. Here two benzene rings are fused together and it contains two nitrogen atoms. Hence it is known as naphthyridine. If two benzene rings are fused together, then it is known as naphthalene. Here two nitrogen atoms in 1 and 8th position nitrogen atom is present, hence it is known as naphthyridine. See, this is the structure of nalidixic acid. This is the first quinolone that was discovered in the year 1962 by George Leeser. So next one, classification. These urinary tract anti-infective agents mainly classified according to quinolones. It can be classified as follows, that is first generation quinolones, second generation quinolones, third generation quinolones, fourth generation quinolones, and miscellaneous agents. See, the first generation quinolones, they are effective against gram-negative bacteria. The example for the first generation quinolones are, that is first one, this nalidixic acid, oxolinic acid, then cyanoxacin. These are all the first generation quinolones. Second generation quinolones, they are effective against both gram-positive and gram-negative bacteria. The example for the second generation quinolones are, that is levofloxacin, ofloxacin, norfloxacin, cyanoxacin, lomifloxacin. These are all the example for the second generation quinolones. The third and fourth generation quinolones, they are mainly effective against the gram-positive bacteria. In addition to that, they are effective against streptococcus pneumonia and other bacterial infections. The example for the third generation quinolones are gatifloxacin and sparfloxacin. In case of fourth generation quinolones, the example for that one is gemifloxacin and moxifloxacin. These are all the four generation quinolones. The miscellaneous anti-infective agents are methenamine, nitrofurantoin, and furosolidone. These are all the drugs. They are effective against the urinary tract infections. This is about the classification. Then mechanism of action. What is the mechanism of action of this urinary tract anti-infective agents? The main mechanism of action of all the quinolones are, it acts by inhibiting the DNA unwinding and duplicating. It mainly affects inhibiting the DNA unwinding and duplicating. It inhibits the enzyme ligase. The example for the ligase enzyme is topoisomerase. What is this ligase? This ligase is the one of the enzyme that unite two DNA together. Ligation means it unite the two nucleic acid together. These anti-infective agents, they inhibit this ligase enzyme. Thereby there will be no unwinding and duplication of the DNA. So thereby it is effective in the treatment of bacterial infections. So next one, structures. The first structure will be nalidixic acid. As I have already mentioned, the basic nucleus that is present in that one is naphthyridine. If you see this structure in naphthalene structure.